Health Convention 2018 online interviews. Today we're going to find out more about the Bowen technique from Paula Esson, the principal at the College of Bowen Studies, who's speaking at the Integrative Health Convention this October at the Park Plaza Victoria on the 13th and 14th of October 2018. The Integrative Health Convention is an annual convention in London featuring many leaders in their fields of complementary and conventional medical therapies to help people get better through these various healing practices. It's an opportunity for doctors, therapists, the public to meet, share, learn from, and connect with each other. We believe that true health is holistic and that people get better in more than just one way. We believe we all have so much to learn from each other, and that the Integrative Health Convention provides a stage for this for therapists, for doctors, and the public. There are, unfortunately, a limited number of tickets available, which can be purchased at integrativehealthconvention.co.uk, and I'll put the links below. This series of online interviews will help you to get to know our speakers better. These speakers are leaders in their different fields of health and healing and medicine, and maybe help you decide which talk to attend out of the 36 talks to choose from over 2 days at the Integrative Health Convention 2018. I'm your host, Dr. Wong, and I've been a GP for the last 12 years in Devon, and I'm co-founder of Neurolinguistic Healthcare Limited, the organizers of the Integrative Health Convention. The Neurolinguistic Healthcare provides courses in advanced communication skills and therapeutic techniques, as well as training in hypnosis for healthcare providers. Today, I'm speaking to one of our excellent speakers who's coming to the 2018 Integrative Health Convention at the Park Plaza in London to share with you what she knows and to tell us a little bit about who she is and what she does and what to expect from a talk at the convention. This is Paula Esson, who's the principal at the College of Bowen Studies. College of Bowen Studies runs courses all over Europe, which helps people and therapists to reduce pain and introduce essential movement through the Bowen technique. They can be found at www.thebowentechnique.com, and I'll put the links below. And this is Paula. Hi, Paula.
Hi there. How are you?
Good.
Nice to meet you.
Thanks for joining us.
No problem at all. Now that we're going to watch the football shortly, aren't we? But this is vastly more important. Before we know what the score is.
Hi, Paula. Shall we start by letting the audience know a little bit more about yourself? Maybe what I didn't cover.
Absolutely. I've been teaching the Bowen technique now for nearly over 20 years, and originally a sports scientist, trained in Northumbria University back in when sports science was a new subject of like the late 80s, early 1990s, and look where it is now. A very established part of health and welfare generally all around. And I was coaching national basketball for many years as a player coach. And I came across the Bowen technique in 1996, which seems like another century now, when I had a cesarean with my son. And, it was an emergency one, and we just had a few complications afterwards and things. I'm a normal, strong person, but I had some sciatic type pain and some very strange headaches and very, very weird stuff going on that no one could seem to get to the bottom of. It turned out to be some blood had escaped during the epidural process very late on during the labor, and that was the cause for all the serious headaches and very strange neural symptoms. And it wasn't so much the traditional therapies which I turned to obviously first that found the solution. It wasn't even anyone at that point knew what the problem was, but I was coaching a basketball game, top level one, and there happened to be a Bowen practitioner there. And he just said, let me give this a go. And I reluctantly, I have to say, at the time, just said yes. And within 2 days, my pain had reduced to a point of I could not ignore the process. And that's what started my intrigue. And then that intrigue moved into me taking, my qualifications as a sports scientist and a lecturer and a coach into actually training in the Bowen technique, which naturally progressed into teaching the Bowen technique. And then I established, one of the first very large integrative health centers in the Northeast, and worked alongside, I say worked, and still working, with the NHS pain management services, the consultants, the doctors, to do exactly what it is that you are so innovatively putting in place. I think there's lots of pockets of this happening all over the country, where we're putting teams of consultants and therapists and healthcare professionals together to treat the person as a whole and hopefully find something that fits them best and get to a resolution so that they can live their lives. It's as simple as that. And as a consequence, take the economic pressure off a very needed NHS. And so much stuff, I think, can be achieved in that way. And yeah, so I've been involved with that for an awful long time. And that was a natural progression into actually running the college now. So we train probably approximately 150 practitioners a year, one way or another, and then do a lot of CPD training with our existing practitioners. So we're at the top end of dealing with musculoskeletal healthcare, pain management, and yeah, good life and good fun, really. That's what we're after, so people can move and live freely and hopefully not need us. That's the plan. There you go.
Oh, many people have heard about the Bowen technique, but what exactly is it for those people who don't know about it?
Yeah, but I mean, we're still trying to figure this one out ourselves as scientists, that we come up with some sort of blurb and then a few years later it changes. But at the moment, right now, before it all changes again, we think we're very much looking at some interesting fascial responses, within the neurology of the fascia, the way the brain interprets the input of the neurological information, and when it perceives pain. Bowen seems to be giving almost an anti-stimulus or a proper stimulus sometimes to sort of say, there's no threat, everything is absolutely okay, and you can sort of switch off, that pain response, because often the cases we found, there is no presence of injury anymore. It's a perception of injury. And, they accommodate their movement patterns and the known compensatory patterns in accordance to this. So we gently, work equal and opposite to the tension in very key areas of the body. So we would look at what we call function junctions, termed by Julian Baker, that these core areas where muscles cross over, tendons, fascia, where, you can put moves directly into an area that has a widespread impact across a lot of surfaces under the skin. And that seems to sort of be sending a little bit like a spider's web or a guitar, a sort of a vibrational neurological input to the brain, and gets it to have a little look. And I say, well, what is actually happening there? And it's just an analogy, but it seems to say, well, there isn't a problem here. Switch off the fire alarms, and then people don't experience their pain in quite the same way. Now, of course, if there's an injury still present in there, then it's a longer process, and often we have to work very carefully through the bioorganism biomechanics to understand what chain of events have happened and how they interpreted their original event in terms of the injury and how they live it bodily. And when we get that right with the Bowen technique, you sort of think you may do a move across the gluteus maximus, then another one up in the top of the head, and another one in the ankle, that if you get the right domino effect, then it's quite remarkable, what the changes happen. And then there's a lot more resources and energetic resources within the human to live their life to the full without the fatigue and without the pain and that internalization that can often happen when you're living a life like that. So this is the start of what we think we're doing, but it's fascia, neural, musculoskeletal, extracellular matrix, brain perception. There's a whole load, and behavior and everything. It crosses over nicely with your neurolinguistics as well.
So is it mainly a manual therapy, much like some forms of massage?
Yeah, I mean, it's a natural place to go. As I say, it's a form of massage because it's hands-on, but it's incredibly unique that our hands are on incredibly briefly, that you do a move and it has three parts to it: a start, a middle, and a finish, a bit like a good book. And there's a definite vibration through the area, or sort of a ripple that goes through that muscle structure, and your hands come away immediately.
Oh,
And that's quite interesting because it's so different to the continual movement of a massage or continual touch. But what that does is allows the brain to have a proper look without any, sort of white fuzz from the TV as such, and any white noise going on. And then another unique part of that is that we would, a bit like acupuncture, we would go out of the room and leave the person to interpret that information rather than impart our belief systems about what we think is wrong with them. Because we do believe that the brain has the innate ability to, sort itself out an awful lot if given the right space and time and the right prompt. So that hands-on, it definitely is, and it takes an awful lot of anatomical knowledge and physiological knowledge to know where you're going to put your hands, and that comes through practice. And say, I can really see that you're holding your neck over to this side, and you're short and locked with that particular trapezius or other muscles of the neck that are involved. And you think, well, there's an obvious one, but this could be a compensatory to a hamstring on the other side. Being the priority mean that our priority is not to fall over. So the body will always work out where it can harness its best power from. And if you can sort out that pattern by doing these very individual, almost they look so minor, but they are so powerful. And that's what confused me at the start as a sports scientist, that I was used to sports massage and heavy techniques and manipulation and adjustment, and we found over all these years we don't need those the majority of the time. We can do people that do need manipulation, we refer once we've reached the end of our focus at that point, and that's where the team comes in. So they need more psychological influence, or more acupuncture, or more rehabilitation, or strengthening, or it's their medication that needs to be adapted by the consultant. So whatever it happens to be, we work in that referral system. But in terms of how the Bowen works, and how we go about it, is very much a hands-on technique which lasts about 45 minutes with breaks in it to allow the brain to interpret. Does that explain that?
Yes, I think it does. Thank you.
Yeah.
And so I'm always curious as to what brings someone to be interested in their field, so in health, in healing. Can you tell me about how you got interested in what you do and the story behind how you started what you're doing now?
Yeah, so in the whole story, as I say, I was talking to my son this morning actually, and I said, I'm doing this webinar tonight, and it's all your fault. And he was like, and he said, I don't know what you mean. He's 22 now, and as I say, it came from this, experience of discomfort and pain that I'd never had before, and very much I'd worked out for my own personality that I'm a coach. I'm always interested in people, moving past my abilities and in improving in lots and lots of ways. So it's very non-ego based. That I get great joy out of seeing people recover. I get great joy about seeing people achieve their best within their sport, and looking back at me with a thumbs up. I love seeing fulfillment. I love to see people achieve and fulfill in a very genuine, honest way, and to use as many skills of my learning and stuff to get there. And that's it's a bit massive driver that. I hadn't realized how big it was. I don't know how far I could take it back as a route. I grew up in Brazil. And interestingly enough, where our house was, my dad's a geologist, a bit like the David Attenborough sort, but on the geology side. And he was working out there, and we had an apartment, and just over the wall there was the poorer section of Rio, and then the struggles and the strifes, and the people worked with us, and and I think witnessing this gave me a real deep social family thread that I wanted to see follow through, that to see how much I could help people as much as I could. And the Bowen technique just seemed to have a humility to it that I hadn't seen in many other therapies. And it's been, it's been a struggle, working with sort of larger teams within the NHS and stuff, and the systems and not the people, never the people, but the system would, create a sort of command control type influence sometimes, which didn't allow a breadth of movements within the therapeutic side to allow people to get better. So, there's all of that as well, that I'm very driven to contribute to that alteration, because in my mind, things are only alternative because they've not been adopted. They sit in this word because they haven't been adopted as a system of care.
That's right.
If it was normalized as a system of care, then we wouldn't be using those words, complementary or alternative. And it wouldn't be perceived as something on a fringe or lower, because in my experience, my colleagues are, so highly trained and so highly intelligent in all that they do. It's just a different form of approaching it. So this is also what sort of got me into it. And then this is what drives me. And it hasn't changed in 25 years. So I'm expecting another 30 years of this. Yeah.
Good. And I hope that as well, looking to be better at what they do and do better for our patients.
Yeah.
So you were going to talk about the Bowen technique at the convention this October. Can you tell us a little bit more about what your talk is about and what the audience will get out of it?
Yes, I'm very much going to be promoting the approach of go gently. So like I was saying, that a lot of interventions have been, whether it's medical or otherwise, is things that you take into your body, or more invasive approaches to the body. And even the Bowen technique sits at the even gentler end of the complementary scale of things. So I'll be explaining from a scientific point of view the reasoning, the possibilities, the hypothesis behind why gentle does an awful lot in terms of pain reduction and in terms of the way the pain is perceived by the person. I'll be talking about the Bowen technique's role in terms of its economics within the NHS and how it can actually really contribute to reducing the bill to the NHS, and the importance of working of that and how that fits into an integrative team, basically, and what role it plays within that, ego aside. That because over the years we've seen thousands of people recover as a result of the Bowen technique. Anecdotal evidence though it is, it's something that we're working on to establish in a more formal way. So that whole talk is going to be about the fun part, and looking at the Bowen technique and its role of being gentle, because getting your head around that is often the first start. But the Robert Schleip in the Fascia Symposium has been saying very recently, there's a lot of evidence now to say the more gentle you go, the more mindful you are, the more listening you are in terms of how you approach somebody, the more trust you can achieve, then you are going to have some serious results. So that's what I'll be talking about.
Great. So having thought about the integrative health convention, where the audience will be made up of doctors, therapists, and the public, where do you see the Bowen technique fitting in with integrative health?
Oh, very much in pain management. I mean, I say I've been working in this for so long at various levels and conventions and government and you name it, that I really think it needs to be at the start. The moment that client or that patient walks in with lower back pain or the usual things, neck pain, lower back pain, non-described pain, chronic fatigue syndrome, all these things are sort of lifestyle, mundane type kind of pain, kind of boring pain really, but very effective on their lives. I think that the time scale there can be shortened massively in terms of intervention. That he said, right, I'm referring you for 4 weeks within a small team to receive the Bowen technique alongside controlling your medication and keeping a good eye, making sure you've got some psychological interventions as well. Then I think this is a very financially effective way forward. And this is what I'll be talking about. If we get in there before an acute problem becomes an incredibly chronic problem, then the bill is going to be a lot smaller. Rather like if you leave your car to be serviced for a year and a half, you can guarantee your bill is going to be pretty much higher towards the end of that. So for me, it's about getting in quick and believing patients as well. When they walk in, they say it's this. It's not just, oh, you have to live with it. I'm still hearing this. It's wear and tear. It's it's just your age. So I'm very interested in what people are being told, because people believe that of the people in trust. And I want to sort of just challenge the narrative around that a little bit, and have people to be believed and then getting the hands-on work that they need and fast. Before we start introducing long-term meds and start chasing other pathways. Yeah.
Well, I think that's so essential with so much that we see. I think there's a lot of research on that as well. Getting early before it becomes a chronic condition.
Absolutely, and I've got a lot of statistics from the Northeast and behind the scenes, and the bill spend on drug intervention. The latest information out about NSAIDs as well. The research saying that we really shouldn't stop the inflammatory process. It's a necessary thing, and if allowed to go through its process, then you're not setting up chronicity in so many ways. And health education without being patronising, very important. And and getting that person in touch with somebody so they got someone to listen. That because I really respect GPs to the moon and back. Make that Pluto, right? A long distance. Because but you don't have the time to really focus on what the story that client is or patient is telling you. And there must be a deep frustration, I think, amongst GPs that the family doctor role has adapted quite dramatically. And I think our role there is that we can listen. We are trained in red, orange, yellow, purple flags, every color flag. So we spot something, we can refer back in for further investigations. And this is where I think it fits, is to take a weight off your shoulders and share this load across a community of experts, basically.
Yeah, great. I think it'll be great when you come, because you can meet with all the other people coming. We have the College of Medicine coming who have that same view, actually.
Yeah.
So anyway, I'm going to ask one last question. As a therapist or teacher with years of experience under, what do you think in particular is the key to healing in what you do? So something personal as to what you think makes the most difference.
You know, I actually think it's so many things, but having an engaging session that includes fun, laughter, whilst being serious about the situation, and the time to really listen to someone all the way through. Those are the key healing things that contribute to a very good session in the Bowen technique. And you know, that's also what again motivates me is that connection, you know, with the person, the time to actually connect with the person, to understand the story, to be available, and to be able to actually sort of follow that person through on a continuity, you know, without diversification. So they have to explain their story again and again. I think that's where the healing lies, is being heard. Yeah.
Great. So thanks a lot, Paula. And thank you all for taking the time to watch and listen to this interview. Remember to get your tickets early from our website. You can follow the links below. We are the Integrative Health Convention in London on the 13th and 14th of October 2018 at the Park Plaza, Victoria. You can use the discount code podcast10, which will give you a 10% discount as a gift from us to you for sharing your time with us. So when we see you in October in London, you'll get to meet myself, Paula, and all our wonderful speakers. There's so many amazing talks. I wish I could attend every single one of them. There are 36 to choose from. You can choose 6 a day. It's going to be great. Okay. Thank you.
Thank you.